And last but not least, this is your last PowerPoint with Justin Pascucci, and it is the Altered Immune Responses PowerPoint. So we're going to talk about hypersensitivity reactions. There's type 1, type 2, type 3, and type 4. Type 1 hypersensitivity reactions are IgE mediated reactions. And what happens is like histamine is released by mast cells. It's an immediate response. B cells are stimulated to produce IgE antibodies, as we talked about with the immunology PowerPoint. And there's two different types of reactions that occur here. And so there's the atopic reaction, which is an inherited tendency to become sensitive to environmental allergens. And examples are allergic rhinitis, which is fairly common, asthma, atopic dermatitis, and urticaria. And then the next one, which is anaphylaxis, and we talked about anaphylactic shock before, but this is a systemic reaction that occurs within minutes, can be life-threatening, and what happens? Airway and vascular collapse can occur. The next one is type 2, which is cytotoxic and cytolytic reactions. Hemolytic transfusion reactions are a type 2 hypersensitivity reaction. So the example is that the patient receives incompatible blood, like we talked about. And then there's also Goodpasture syndrome, which is a rare autoimmune disease in which IgG forms in lungs and kidneys and ends up resulting in pulmonary hemorrhage and glomerulonephritis or a kidney injury. Type 3 hypersensitivity reactions are immune complex reactions. Damage occurs secondary to antigen-antibody complexes. This one I always think of lupus and rheumatoid arthritis. And then type 4 hypersensitivity is the delayed hypersensitivity reaction. It's also called the cell-mediated immune response. Examples are contact dermatitis, poison ivy, and then another one is actually going to be when we get our TB shots. That's a delayed hypersensitivity reaction if you end up positive. So this comes up a couple different times because NCLEX loves anaphylaxis. So clinical manifestations of a systemic anaphylactic reaction are going to be any head to toe system. So neurologically, we could see headache, dizziness, paresthesia, feeling of impending doom is huge. Skin, we see pruritus, erythema, urticaria, which is hives, angioedema, which is that swelling of the lips, tongue, airway. Respiratory, we see hoarseness because they can't talk, coughing, sensation of a narrowed airway, wheezing, stridor because of that narrow airway, shortness of breath, maybe elevated respiratory rate or respiratory arrest. Cardiovascular-wise, hypotension. Why? Because of the declined cardiac output. Dysrhythmias, tachycardia to try to compensate for that decline, and cardiac arrest. And then GI, we might see cramping, abdominal pain, nausea, vomiting, and diarrhea. So our emergency management behind anaphylactic shock, we're always going to think first we're going to give what? Or we're going to do what? We're going to ensure that the airway is patent. Next, you can administer high flow O2 if you have it on hand, like in the hospital. Make sure they have IV access established. You can give them epinephrine every 2 to 5 minutes. And what's epinephrine do? It dilates the bronchioles, it constricts the blood vessels, and it improves cardiac contracture. We give them nebulized albuterol. We can give them steroids for persistent hypotension. We maintain the BP with fluids, volume expanders, and vasopressors, such as dopamine. So usually the train of thought with anaphylaxis is give them epinephrine, then start them on dopamine to keep their veins pressed, to keep trying to bring the blood pressure up, and then you can give them norepinephrine as well as a supplement. And of course, we should anticipate the need that we're going to have to intubate them. They might require a cricothyrotomy. Why would they get a cricothyrotomy? Well, if they have some kind of facial trauma or obstruction in which we can't get to the trachea, basically you make an incision through the skin and the cricothyroid membrane to establish the airway. Or possibly a tracheostomy as needed. So depending on the type of allergy you have, you can train your body to become less allergic, and that's what we do with immunotherapy. Immunotherapy is a treatment for allergic reactions to substances like grass pollens, house dust mites, and bee venom. It involves giving gradually increasing doses of the substance or allergen to the person that is allergic. The incremental increases of the allergen cause the immune system to become less sensitive to the substance, probably by causing a blocking or a production of a blocking antibody, which reduces the symptoms of allergy when the substance is encountered in the future. Immunotherapy also reduces inflammation that characterizes asthma and rhinitis. So these are those allergy shots they can get either weekly or bi-weekly, and it often takes 1 to 2 full years for them to reach their maximal therapeutic effect. Latex allergies are unique because they can be represented by 2 different types of hypersensitivity reaction. The type 1 hypersensitivity reaction is going to be most likely like an atopic kind of reaction in which the person develops a rash or itchiness as soon as they touch the latex. But then there's also the delayed reaction, which is the type 4 hypersensitivity reaction, in which the person would have contact dermatitis. There is an interesting phenomena too with latex allergy. So people who have latex allergy most likely will have a positive allergy test to another to a related food, and it's usually like tropical fruits like bananas, avocado, kiwi, guava, hazelnut, things like that. Tomatoes, potatoes, peaches, grapes, apricots. Symptoms include skin rash, hives, flushing, itching, nasal, eye, or sinus symptoms, asthma, possibly even shock. Patients should wear a medic alert bracelet, and they should carry an EpiPen if they have a latex allergy. And we need to know in the hospital if they have a latex allergy because a lot of our gloves have latex in them. So if that's the case, you can get a latex cart outside of their room to make sure that people are using latex-free PPE.